All right, welcome to SLP215. All right, this week, neurogenic disorders. So this is kind of a blanket term, and I like a lot of these disorders, but definitely hold on. One second. Get on the right page here. So neurogenic disorders, like I said, it's a blanket term. Here are the common progressive, and what that means is it gets worse, it doesn't improve. So at this point anyway, hopefully maybe modern science can change things, but don't know. Anything's possible, right? So Parkinson's, multiple sclerosis, amyotrophic lateral sclerosis, ALS, as we commonly know it, Huntington's disease, dementia, and brain tumor. So definitely someone has a brain tumor that's growing. Oftentimes we see progressive neurological issues. That's not an exhaustive list. So there are others. Those were just kind of the top common ones. So Parkinson's is a progressive nervous system disorder that affects movement. So they start gradually, and you might just have a tremor. Tremors are common. So now just because someone has a tremor doesn't mean they have Parkinson's. But the disorder also commonly causes stiffness or slowing. So it's a slowing down of movement. So those are some telltale signs. So a lot of times we see Parkinson's, a lot of times we work on compensatory strategies. We work on some feeding alterations with how they swallow and might, hand to mouth, some stuff like that. They might get some other therapies, but definitely Parkinson's, it's one of those things that can progress very fast. I do think some of the newer therapies are really slowing the progression of the disease. So there is some exciting, actually, ALS is another one. So obviously that affects nerve cells in the brain and spinal cord, causing loss of muscle control. And another layman's terms, Lou Gehrig's disease. So ALS, definitely there are some different kind of what I say, not strains, different types of ALS. And there's some that are very slow progression, some that are very fast progression. So definitely some things there that can change. And obviously oh gosh, ice bucket challenge. So I did have, and this was kind of a newer thing, and I didn't even know it could exist, but I had a high schooler a couple of years ago. I knew this girl since she was, a first grader. She was junior, sophomore. It was like in a sophomore year, beginning of junior year. And, she would make comments like, she's like, my hand isn't working. No, she was goofy. She had some other stuff. So I had seen her since she was a first grader, but she started making comments that was unlike her. So I talked to her mom. Mom was wonderful. We had a lot of discussions about, hey, and then her tennis coach. So one of the tennis coaches was another SPED teacher. This girl was a star tennis player and very good, and had been playing tennis since I known her as a first grader. And she kept saying, it's like she forgot how to play tennis. It's like she can't quite coordinate. It's like she couldn't get a serve over anymore. Like a lot of things like that. Mom thought maybe it was like a pinched nerve. She started kind of limping, which was weird. Never seen that out of her either. And I remember sending the physical therapist. I said, hey, what do you think? I'm trying to give this mom direction. I remember the PT, she came back to see me. She says, oh my goodness. And she knew who this particular student was. And she also had known her for a long time. She says, you know what, this doesn't look good. She's like, I'm getting some kind of progressive neurological sign. So she's like, maybe muscular dystrophy. It's rare in girls, not common at all. She's going down the whole list, and none of them sounded awesome. So well, that's strange, she's 17. But I mean, she, within 6 months of getting that diagnosis, it took a couple months to get the diagnosis, she had passed away. I mean, it was incredibly progressive. I mean, it just was we couldn't believe it. But so that ice bucket challenge went around, and actually she had some ALS, and they call her patient 0, that they hadn't seen before. So, and her parents donated her body to the main researcher at Emory, which I think is cool. So her parents will send me articles and things about her. So I'm kind of up to date on ALS stuff, because, I'm really good friends with her parents, and they share information. But again, I work with her on other things, but I started to notice things that concerned me, and I got some other people involved. So what we also know too, MS, you can see very young. Oftentimes when we're working with our adult population, things have changed for them. So it's sometimes too, with some of these progressive disorders like Parkinson's, like ALS, like Huntington's, we kind of do one thing, and it's more to teach compensatory strategies than to make things better. It's more of what I would say compensatory therapeutic intervention versus we're trying to regain skills. We're trying to make it functional. So you might see them at different points of their disease. So that's the other thing too. A lot of times they have to revisit some therapy to get, like for instance, if they go to the physical therapist, it's usually to get update on equipment, more things to access and for mobility. For us, it's more, can we still eat? Can we still communicate? So those are kind of the two things. Huntington's disease, definitely, it's early. That's an earlier, and that's what I think and she was adopted. This particular girl was adopted. So we didn't have a lot on her, her birth history, but that was the first thing that the PT I worked with, she suspected Huntington's, just because that was the time when you can start to see it. So she was guessing Huntington's. So dementia. Now, obviously there's Alzheimer's. Dementia is a general term for memory, language, problem solving difficulties. Obviously Alzheimer's is the most common cause of dementia, but here's the other part is oftentimes if someone's going through like early onset, oftentimes if we work with our patients with dementia, that kind of thing, we're working on the compensatory strategies, and obviously too, are they responding to those compensatory strategies? So brain tumor, that's another one. All kinds of different types of brain tumors. So here's some common speech and language needs through their progressive neurological disorder, whatever it may be. So speech difficulties. So we often see dysarthria and then dysphagia. So obviously their intelligibility decreases, their ability to form the sounds decreases, as well as in their ability to swallow. So definitely speech difficulties is usually one. Then we see language stuff. So cognition, decision-making, word finding, we see lots of difficulties there. Functional. So focus of therapy may be to learn alternate modes of communication or sequencing and performing daily living activities. So oftentimes it's like, here's the self-check. So somebody with dementia, okay, did they brush their teeth, comb their hair, get dressed? Things like that. We work on some of those sequential daily living things to help them come up with compensatory strategies so they can continue to perform those. And then, executive function, difficulties with timing, pacing, organization, following a direction, definitely some challenges there. they might also struggle with like time concepts. Scheduling might be a real challenge. So the main thing that we know for a progressive neurological disorder, you will never be the only professional that these people see. So it's teaming. A lot of what we do is teaming. We're one prong in their intervention. So there's obviously a team, there's a doctor, and then there's often other therapists. So quite often, especially with these progressive neurological, they've got physical therapy, they have OT and then speech, or there might be some other things like respiratory, other allied professionals. I just thought of not chiropractic. Why can't I think? Oh, it eluded me. I want to say nurse practitioner. That might not be it too. But other allied health professionals might be involved. The other part too is some of them might be working with a social worker, or families working with a social worker who's kind of organizing some things, or guiding the family through the next steps. So for instance, somebody with dementia, you might be the therapist working with somebody, and we're trying to determine, are they safe at home? Are they not safe? Can they follow the sequence? Do we have a good checks and balance system in to make sure they're doing the things that they need? Obviously, medical team of doctors, specialists, medications, and then the family environment support. So really, these people who have these progressive disorders truly need their family and environmental supports in place for them. Super critical for them, very important. And really, your focus and what you're doing with them will likely change several times over the course. So definitely, as their clients' treatment and management of their disease, then the needs change, and then they get the appropriate team individuals involved in that. So definitely, we could be a short-term role, we can be a long-term, and kind of come in and out. So definitely, or might be a need, not be a need at first, but then becomes a need. So those are some things to think of when we're looking at some of those progressive neurological disorders. So this observation is a neurogenic speech disorder. So definitely look at that. I don't know if any of you have had any close loved ones, family members who have gone through progressive neurological disease. So for instance, someone I did know, my grandmother had Parkinson's, and, she passed away when I was in high school. And I definitely remember some of those things that she struggled with. Definitely some of the motor capabilities was a struggle for her. And it was compounded. She had really bad arthritis. She also had, why can't I think of it? Like I said, my word finding difficulties definitely escalate after 7 o'clock at night. It's autoimmune. Oh, it'll come to me later. But she had some autoimmune stuff before that. So definitely some things that were already pre-existing, and then you get Parkinson's. It was kind of amplified, I think, in her particular case. Or like my dad said, I don't think maybe all of that was diagnosed correctly. So he might be right about that. So there is an assessment. So definitely be familiar with some common neurogenic disorders. And what are some things that you do as a therapist with these disorders? What are the common needs from a speech therapy perspective? And definitely know to, what are the types? So when we see ALS, what happens? Parkinson's, what happens? Huntington's disease, what happens? So be pretty familiar with those that are mentioned, like I said, and that's not an exhaustive list. So those are the most common ones. And I can't remember, I talked about muscular dystrophy is another one we see commonly. I don't know why that's not on there. I can't remember why. I remember us having a discussion with other professors about why to put it in there or not. And predominantly, usually muscular dystrophy, that's mostly physical therapy, but we kind of come in, but usually those individuals often get feeding tubes pretty quickly. We're usually not working on feeding. So it's more about they just get the nutrition in. But a lot of them have to learn, you know, they might be walking, they need to learn how to use a wheelchair. Let me look this up. And then ALS is hard because oftentimes we don't know the pace at which that's going to, but we do know they can live for several years without the ability to speak. So definitely working on that augmentative communication. So what we call front load, we give them that that comfort, they learn how to use it, they become familiar with it before they absolutely lose. We don't want to ever have somebody who we know who's likely going to lose the ability to speak, learn something by the time they get to that point. We want them to be well versed, so when the time comes, they have it, they know what to do, they know how to use it, they know how to access it. Family members are comfortable with it. So there's observation, assessment, and then a read and review summary. Any other questions?
I have a question.
Mm-hmm.
I can't copy the Google slide presentation. Am I doing something wrong, or is it because it's a Google slide? It's usually a PowerPoint.
Yeah, I know. That's a good question.
Let me know.
I might post something. Thank you for bringing that up. 1 second, let me make a note so I don't forget. And then I don't know if I reiterated it. If anybody needs to work ahead, work ahead. If anybody has any pressing timeline, please let me know for graduation. I know that's not as much of an issue in this class as it is in other classes, but if anybody is trying to meet a deadline for whatever reason, please let me know. I don't want to be tardy on getting a grade in so someone doesn't graduate. I don't think that's but every now and then somebody missed a class for whatever reason, and they're just taking it this semester. I'm usually aware of those, but I don't know, this year has been crazy, not normal. And everything's off this year in so many ways. So please call to my attention. I do not want to not cause someone to graduate. But yeah, if you guys want to work ahead, you can work ahead. Truly, so somebody asked about the final exam. I'll make sure I'll have that study guide up this week. Sorry, I'm making notes. And then it won't let you copy the presentation. Okay,
Nope.
I'll try and fix that for you.
Thank you.
Any other questions?
Yeah, I have a question about the quiz.
Mm-hmm.
I don't know if you said, but is it a short answer response? Like we have to type it out?
I'm pretty sure it's multiple choice.
Okay.
There might be one fill-in. I looked at it 2 days ago. Do you think I can remember all of it? No.
No, it's
I'm pretty sure it's all, it might be one fill in the blank. I'm pretty sure it's all multiple choice, but I will post an update on that too.
okay. It's okay. It's not a big deal.
Yeah, I know. Well, you guys like to know, and it's helpful for you guys when you're studying. I definitely know that. So when in doubt, you can just choose one. You got a 25% chance of getting it right.
Right.
Any other questions? I don't think I'm too far behind in grading. A couple people have been having problems with videos. I'm not sure if that's this class or not. So check, if you don't have a grade in there, be sure to check the comments and alert me. Sometimes I get an alert that somebody updated something, but I haven't been getting things the way I used to ever since the whole change this over spring break with the logon, stuff like that. So I don't feel like things are set the way I used to have it set in Canvas. So please alert me if you're like, hey, I still don't have a grade for this. And any other questions. So appreciate you guys' patience, sticking with me. And that's it.
So I'm one of those people that I'm having trouble with uploading media.
Okay.
And I've emailed you the video.
Right. Okay.
So I don't know if you got it. So I don't know if you want me
Okay.
to email you again.
Did you email me or send it on a message in Canvas?
Oh, message in Canvas, sorry.
Okay, I'll check. I think, did we just correspond this week or was it last week?
Last week.
Okay, I will double check. I need to double check the thread then.
Okay.
Because sometimes, like I said, things just haven't been quite the same. So,
Okay,
and then by Friday, if you don't see your grade updated, there was one I got, but I might not have messaged you back that I got it.
Okay.
There's 3 people I've been corresponding with about issues with video uploads. So I will double check.
Okay, thank
Sorry,
you.
I'm making notes here. Okay, yes, and when in doubt, if it's not letting you upload, just send it to me in Canvas. It's not our preferred choice, but that's better. And then sometimes people have sent me the video, but it's private, so I can't see it. So there's 3 people between my 2 classes that it's the video is there, I see it, but I can't view it. It's sent as private. So I usually send, hey, I can't see it. So you have to change the settings on YouTube. And that's really it. Usually it'll let you load the video straight from your phone or computer in Canvas. And then let's see. So,
Oh,
yep. And then a study guide. Okay, hold on, I'm writing that study guide this week. Okay. All right, I might put some updates on in the announcements about a few things. So always check announcements too. Okay.
Okay, thank you.
All right, thanks guys.
Good night, everybody.
Good night.